Hello, this is a case of a 30 years old patient who was referred for examination MRI of pituitary due to the incident of diabetes insipidus. What we have here, this sequences is a coronal T2 weighted sequence. Very important to have relation of the adenohypophysis against the optic-chiasm and general signal. Then we have the sagittal T1 without contrast. That is also a very important sequence. Then T1 post-gadolinium sagittal and T1 post-gadolinium coronal. So what we can see as expected is that there is a lack of high signal intensity in the neurohypophysis, lack of a typical bright spot that we should see. Then in the first idea you would think, okay, so it is some kind of hypoplasia of neurohypophysis, but wait for it. So in order to exclude hypophysis adenomas, which are mostly located in the adenohypophysis, the anterior part of the pituitary, we look at the sequences post-gadolinium that show homogeneous contrast enhancement in the adenohypophysis. Here this little discrepancy is due to the central part that is enhancing more. So, and we don't see anything wrong on the T2 weighted image. So this is normal anatomy. So we look carefully at the adenohypophysis and we do not define clear microadenoma. However, what we can see is the infundibulum is a bit thicker than normal here, for example. As well as on the sagittal image, we can see that there is, in fact, contrast enhancement of the neurohypophysis as expected. So, in fact, the neurohypophysis is present, only the signal is absent. And now the combination of two factors, that is the lack of bright spot in neurohypophysis with thickening of infundibulum, and the anamnesis for diabetes insipidus strongly suggests to us that the case could be of lymphocytic infundibuloneurohypophysitis, LINH. This is inflammatory disease that is affecting the function of the pituitary stalk and neurohypophysis function that resulted in the hormonal changes. There is differential diagnosis of the IgG4 related hypophysitis. So we as radiologists describe the findings, suggest the diagnosis, and the doctors will do endocrinological studies to confirm this. Thank you for watching this short case. If you like such cases, you can review my previous cases, like and subscribe, and I see you in the next one.